Welcome to today's webinar, A New Vision for Income Security. My name is Natasha Pei. I'm a community animator for Vibrant Communities Canada, and I'm here today with Laura Katari of the Hamilton Roundtable for Poverty Reduction in Canada Without Poverty. I'd like to start us off today by introducing Laura. Laura is a member of the Ontario Ministry of Community and Social Services Income Security Reform Working Group. Laura works for the Hamilton Roundtable for Poverty Reduction, is an active Cities Reducing Poverty member, and a campaign coordinator for Fix the Gap, a campaign that is working to realize what an adequate standard living costs in Ontario. Laura is also board president for Canada Without Poverty. So welcome, Laura, and thank you so much for joining us on today's call to look at this Income Security, a Roadmap for Change report.
Thank you so much, Natasha, and thanks everyone that's joined the call. I apologize for my wonky voice today. This is my first day back having a voice again. So yay, I'm personally happy to hear it. So I'm here to talk to you about income security, a roadmap for change. It was actually released November 2nd of 2017, but it took just a little over a year to put together. And so what I'd like to start with is just a very quick overview of why we're doing this. And what you see up on your screen right now is an overview of how much is spent federally and provincially on income security benefits in Ontario. So this is not right across Canada. It's simply what is in Ontario. More than half of it is focused on seniors and retirement, and the other half takes care of children and working age adults. And as you can see, it's fairly costly. Poverty in our province right now costs us $32 to $36 billion a year, and that is a cost of approximately $2,300 per household in Ontario. And that's pretty steep. So creating the roadmap, it's important to understand the government of Ontario, namely the Ministry of Community and Social Services, brought us together to create the roadmap. And they asked us to create a multi-year plan. So unlike commissions which research the state of things, this is an actual work plan for the next 10 years, looking at the entire income security system. Our goals set for us are to reach a modern, responsive, and effective system, and effective also for recipients. Help those most affected by poverty, keep others from falling into poverty, and improve our overall prosperity in Ontario. It's important to note there were 3 working groups. So the Income Security Working Group was the one I sat on, and it was made up of people, managers from Frontline on Ontario Works and ODSP offices, but it was also made up of really strong anti-poverty activists and advocates. We had Mary Maroney from the Income Security Advocacy Center in Toronto. We had Dr. Gary Block, who has tirelessly been looking at social determinants of health and helping us understand the impacts of keeping people in deep poverty, especially through social assistance. And then people like me. So I myself am someone with lived experience of poverty, close to 14 years. I have a disability, and I have worked approximately 6 years in the anti-poverty sector, first as a volunteer and then in a paid position. But we also had 2 other groups, and one is the Urban Indigenous Table on Income Security Reform, and the other is First Nations Income Security Reform Working Group. The 3 tables did not have direct contact, but we did share our writing and made sure we built consensus across the way. There was nothing that we said in the Income Security Working Group that was not approved or perhaps edited for language by the other groups, and vice versa. And amazingly, it ended up being a pretty cohesive document that way. We decided right from the start we needed a vision of the future state to help us as we encountered challenges and different areas of the system to keep us on track, so to speak. So the outcomes we were looking for: essential health needs met, effective safety net, which currently in Ontario we don't have, adequate employment supports, safe homes, support for persons with disabilities, and help raising children. But for me, the really important part, and I think the part that can be universal across Canada, are the guiding principles. So in no particular order, we wanted to make sure whatever we did aimed towards adequacy. And when we talk about adequacy, we're talking food, shelter, clothing, the ability to participate in your community, whether that would need a data plan on a cell phone, transportation costs, keeping people connected to their communities. And we also wanted a rights-based approach that would take in the rights of Indigenous persons, the rights of children, etc., judgments that the Supreme Court of Canada had come to. We wanted to make sure that the dignity of all individuals and their rights not only were considered, but a method of evaluation and recourse was built into what we were doing. And of course, reconciliation. Reconciliation was a huge aspect of this document. Spelling out the sovereignty of First Nations was paramount to getting this report correct. And of course, the funding that goes through with that. Access to services. It's one thing to have a service and quite another to be able to access it. And we wanted to make sure that no matter where you were situated in Ontario, that access was possible. Economic and social inclusion, and one of the things as you read the document, you'll realize economic inclusion and success in that area is relative to the person you're engaging, and respectful and mindful of whatever point people are in their lives. Social inclusion, we've come to understand through many other reports that came before us, is paramount to not only keeping people connected to communities, but also as a stepping stone to either volunteering and being able to contribute back in that sense, or through job search. Equity and fairness, making sure that all evaluation and everything we're looking at worked for everyone and that no one would be left behind. And of course, sustainability in terms of cost and respect and dignity for the individual. So the roadmap for change has 7 distinct areas that we wrote about, and I think today we're going to focus just a few that can be more universal. So achieving income adequacy. What we realized from the start that income adequacy could not be achieved through a single program, that it wouldn't be just social assistance that would have to support all individuals, that various levels of government and various programs would have to be stackable, that there wouldn't be clawbacks, but other levels of government would have to engage either through the tax system with programs like the working income tax benefit, but also programs like employment insurance, Canada Pension Plan Disability, which in Ontario at the moment are clawed back dollar for dollar against Ontario Works or Ontario Disability Support Program. What we decided there had to be in order to have an evaluative approach is a minimum income standard that would be set and calculated on a regular basis to ensure that it was adequate and that would be achieved over the next 10 years. And just an aside, for the whole 186 pages that were written, this is the only area of contention, and especially at our table in the Income Security Working Group table, was the rate in which, how fast we achieved the minimum income standard. I can say for myself personally that I don't think it's fast enough. I find it difficult to say, yes, we'll get people to this amount in 3 years when I know that's still not adequate to eat properly and engage in community. But it had to be put forth, and with that, the demand from the Ontario government that this, quite frankly, what we have in our report, which is Ontario Works 10% year 1, 7% year 2, and a 5% increase year 3, ODSP 5% for the first 3 years each year, be the minimum, the absolute minimum that the government could do and move forward. I'm going to explain as well, with income adequacy, currently in Ontario, we use something called PRS-LIM, which is Poverty Reduction Strategy, low income measure, which is 50% of the average income in Ontario. And that's tempered slightly with a very rough market basket measure. And something personally I've been working on that I brought to the table was the concept that this is a relative income measure. It compares two groups of people and how much money they have, but it doesn't tell you anything about how much it costs to live and how much deprivation people experience. What are they not able to afford to purchase? So we've also recommended under income adequacy that we develop a Made in Ontario measure that looks at what it costs to live in different economic regions of Ontario, major urban centers, mid-sized cities, small cities, rural and rural remote areas of Ontario. And that these numbers be attained not only by economic professionals, but that the market basket have participation from people with lived experience in it. Engaging the whole income security system, again, making sure that EI and CPP disability works in conjunction with social assistance systems. Programs like the working income tax benefit in Ontario at the moment work great for families, but unfortunately for single individuals, there is a $500 window of earnings where you actually qualify for the working income tax benefit, and all people above or below that income level get absolutely nothing. So looking at adjusting that. And just a side note on that, we're asked not to look at federal programs and comment on federal programs. And in the end, we found that was very difficult. And that's around page 145 in our report or roadmap, we have listed working income tax benefit as something to be adjusted for the federal government. So transforming social assistance, and I think this is a big one probably for most people that are on the call. And we're looking at it in a few different ways. One, dealing with how people are treated on the system in terms of rules and regulations, and two, how people interact with the system, and namely frontline workers. So in terms of rules, I'm going to give an example of a rule that's out there at the moment. So there is a rule that you must have an address in order to claim social assistance in Ontario, even if that be a regular shelter that you attend. But you must be connected to an address to receive full benefits, because benefits are listed as both basic needs and shelter allowance. So to make sure that people can claim the full amount, they have to be spending more than the shelter allowance, and then that starts to eat into their basic needs. These rules around housing also limit who you can live with, how many people you can live with, in order to make your life more affordable. So one of our recommendations is what we call collapsing the rates, or creating a flat rate, so that the OW rate is just one amount. ODSP is one amount, a flat rate. And that way, if for some reason someone lost housing, they would continue to receive a check so they can afford first and last. If you're in Ontario, you'll know that we lost community startup and maintenance benefit a few years back. The money is being rededicated through what they call CHIPPY funding, but the program as it existed does not exist anymore. Municipalities are able to spend that money wherever they see the need, and even some municipalities may not have assistance with first and last month rent anymore. So by able to collect, say while you're couch surfing for a month, you're able to pay first and last month's rent, which was one of the biggest pluses with collapsing the rate. The other plus, of course, are for municipalities and for the government, who spend 65% of their time with frontline workers doing administrative paperwork. By collapsing the rules, the rate, and getting rid of border allowance and personal needs allowance and all the different housing types, it really frees up a lot of time for caseworkers to focus on clients rather than doing paperwork. And the other aspect of transforming the system, which for myself, in my own experiences, I really pushed for this change, was the idea of a trauma-based lens when dealing with clients on social assistance. The development of a new tool that would help no longer caseworkers, we actually call them case collaborators in our document, to assess all the needs an individual has, not just cutting a check for them. So that would look at, do you have safe housing? What's your family relationship like? Do you have supports, familial supports? Do you have friends that you are in contact with? And do they provide supports? What's your health like? So you don't need to have a disability to deal with health issues, first and foremost. And this came about because we realized very early, I was on a disability subgroup trying to make recommendations for ODSP. And we realized 80% of individuals on our disability program came from Ontario Works. In other words, They either had no disability supports or ran out of their employment insurance sick benefits and ended up on Ontario Works before their case was adjudicated for ODSP. And in realizing that, we realized this technique had to happen at the Ontario Works level, that you had to assist people with more than just income, that assistance was needed to navigate community systems, whether it would be housing supports, whether it would be looking for recreational activity to keep people active and engaged. One of the case models that I have developed in talking about this was looking at an individual who, say, was in their late 20s, early 30s, and encountered their first major depressive episode. Major depression usually can be treated with medication, but it also requires some time off until someone is able to function and focus at their jobs again. Unfortunately, many jobs don't have sick benefits. They don't have short-term disability insurance. Many people today in Ontario, and especially in Hamilton, are up to 80% applying and being denied EI right now because they don't have enough hours. So where did they go? They turn to Ontario Works. They don't apply for ODSP because it's not something that's supposed to be over a year before it's reconciled. And yet we have a system that will add additional trauma at this time of crisis. And so dealing with people in a holistic way, taking into account perhaps a depressive episode, maybe even identifying that possibly someone may need to be assessed for depression. They may have lost their job and not understood why they're unable to focus and why they feel so sad, why they feel more irritable. So we think that's a huge part of changing the system, that the system should be there to help people, that every touch should be a positive touch. And while we're talking about social assistance, we really want to make sure that we help those in deepest poverty first. And through federal Canada Child Benefits, we have seen in Ontario a huge increase in the household incomes, especially two-parent households, even if they're on social assistance, making it close to or slightly above the PRS limb in Ontario. But what we have found, single parents, but most especially singles on both Ontario Works and Ontario Disability Supports, are in the deepest poverty in this province, and why we wanted those rates raised so quickly. And reporting on progress, sorry, I'm going to just take a look at my time at the moment. Okay, so reporting on progress, I think, is actually another innovative portion. We're used to most reports from a community and social services aspect dealing with how many people entered the system, how many people exited the system, and how much it cost them. And while those numbers are important, we feel, and especially from a human rights framework, that sub-data needs to be aggregated or disaggregated in this case. So we need to know on a racialized level, we need to know on a disability level, we need to know women, we need to know Indigenous experiences. We need to be able to identify who is being served well, and who still needs additional supports or changes in the way supports are delivered, who is able to access supports. And possibly the most radical portion is actually looking at a more subjective outcome as well. Are people happy? How stressed are people? Are people able to envision a future? Are people engaged in their communities? Are people upgrading their skills? Have people made it through the legal system in a timely manner? Have people made it through the health system in a timely manner so that they can get on with their lives? And we believe this accountability should be tied fundamentally into not only program design, but program reevaluation. That at no point is a program set in stone. And at no point should regulation, and I'm not talking legislatively, but the actual rules be set in stone, that they should be able to change as different groups come through, as the economy changes in the province. So what's next? There is a 60-day period for feedback. We asked them to delay by a few days. The original cutoff date was January 2nd, 2018. We've asked now for January 5th, so that once people get back from seasonal holidays, that they have a few days to submit their feedback. There is no formal consultation process, only people like me that are going around and actually talking about what's in the document. On the website, which is ontario.ca/pages/income security, can you find some few basic questions. What do you like about the document? What do you think is missing in this document? And if you had to prioritize, what part of the roadmap will you prioritize? And the reason why the government is asking this is that early in 2018, I'd say probably around sometime close to the budget, they will announce a multi-year plan based on our plan. Some things I just want to say generally about this is that we firmly believe as a working group that this document cannot be cherry-picked, and as well as a more supportive role that casework would have, it will not be as helpful to individuals if they are still left in abject poverty while trying to move ahead. That the trauma approach and this trust and collaborative approach, the relationship that is built, will be useless, quite frankly, if people are still hungry on the other side of the table as they're dealing with them. So I think I've gone through this as quickly as possible because I know there are a lot of questions. So Natasha, I'll pass this back to you.
Thank you very much, Laura. That was such a wonderful presentation, and really some things that I pulled away from it were, just overall how holistic it is of the entire system that looks at income security within the broader system and all of the moving pieces, the people, the workers, the policies, the rules, all of that is part of the system, and that all needs to shift together. And I just really appreciate how that was grounded in respect and dignity and flexibility and recognizing the uniqueness of situations. So thank you very much for that. We do have several questions, and by all means, I see a couple already in the questions box. Send in your questions, and we'll just start off with a couple that have been submitted in advance. Laura, I actually had one for you first. You mentioned at the beginning of your presentation that you do have experience living in poverty, and that you have a disability. So I'm just wondering, from your own experience, how has that experience played into this work, and how?
Well, thank you for that, Natasha. I think, and I would definitely need feedback from my fellow working group members, and I have received actually feedback since letters sent to me. It's the ability to meld policy with real life impact. So to be able to hear a policy and be able to feed back to the group what this actually looks like in practice, and being able to stop and say, no, you don't want to go down this road because you will, for example, not motivate people to try new things if they're in fear of losing X benefit. Or somewhere along the way being able to say, you know, it's really great to see a chart of how much food costs, how much shelter costs, and then look at all the other expenses, when in reality what we see on the ground, and personally for myself, you can pay your rent, you'll pay your hydro, you'll pay for something, I call it my communications amount, so a telephone, internet access, and then you pay for food because it's the only thing you have control over. And understanding when you raise the rates, you might not be actually giving people more food by raising that rate first, by an incremental amount. And it's those kind of discussions, I think, that make the report richer, and the immediacy, I think, the tone and language.
The stories and the outcomes. I think there are a lot of programs with great intentions, but people who are moving through the system don't always experience it in the way that it was meant, the programs were meant to. A couple of other questions, let's see. The first one was, how might these principles apply to municipalities who are trying to support Indigenous people in all aspects of poverty reduction? So homelessness, housing, childcare, employment.
Thanks for that. So I think if we go back, and if you don't mind, I'm going to scroll right back to the guiding principles. I think all these principles need to be incorporated, and I'm going to go specifically to urban Indigenous since we mentioned municipalities. Urban Indigenous groups, whether it be regional friendship centers or women's groups, keeping in mind rights and respect and a focus on adequacy are all fabulous. But I think first and foremost, you need to actually appreciate and be willing to learn what it is Indigenous groups actually want. What we've come to understand is this top-down, we have a program that we're going to give to you, doesn't work. We need programs that are based in Indigenous medicine, for example, that heal Indigenous persons and are respectful of culture. One of the things in the roadmap that was quite specific that I was so happy to see is talking about caseworkers going out to community centers, Indigenous community centers, and learning that it's not always bringing people into the office, and sometimes you need to engage where people are at.
Mm-hmm. Thank you. And one of our other questions was about tools for implementing. We actually had a couple of questions. One looks at it from more of the client experience or the person who's using the system, and the other is for frontline workers. So the first question is, will there be a new simple integrated technology created between various programs and services to share information freely and prevent clients from having to retell their story and provide the same information over and over? And then the second one is, will there be any tools to support frontline staff in all roles to deliver and champion this cultural shift?
Thanks for that. So the two actually do go together quite well. So first and foremost, everything we did was in conjunction with current working groups, whether they be departmental internally to the government or other working tables, like say the housing providers table. So we got to work with a group called Modernization Working Group. And the Modernization Working Group looks at all technology. And looking at things like eventually being able to apply for assistance online, being able to book appointments online or through smartphone-friendly application methods that you can call in as well. With those ideas, we also want to make sure, and this is stressed in our new case collaboration model, that your caseworker should be really your first contact, that you shouldn't be going around and telling your story to a whole bunch of different people. And from there, you can have a specialist that will deal with housing. You could have an employment specialist if you needed. But all of it and all the information flows from your primary caseworker. That's part of building trust with the individual so that one person actually knows what's happening in your life and actually cares and follows up to make sure that whoever you saw had, and we call this positive touch, that every time you've engaged the system, you've come away better off. Not neutral and not negative, but actual positive touch at every touch. For caseworkers, I mentioned earlier a new assessment tool. And that would have to be worked into our current SAMS system, and I know saying SAMS can give people possibly on the call shivers. It did not roll out as successfully as they hoped, but they are still working on modernizing it, so we'll need a physical computer tool, but it will also be co-designed with people with lived experience, with frontline workers, and with other professionals in the community. And the rollout of this is important as well, that it can't be something decided in a rule and then rolled out across Ontario, that you need test sites and it needs to be adapted and changed as it develops. It needs to be done in practice, as I say, as opposed to just all theoretical.
Thank you. And again, that's really going back to that relationship and having your worker right now be a real relationship of trust and a champion or an advocate within the system. That's great. We have a couple of questions that are asking about I think different demographics and how they fit into this roadmap on income security. So one looks at seniors and how they've been included in the roadmap. There's one woman saying that the guaranteed annual income system, the GAINS, which is cost shared between the provincial and federal government, that benefit hasn't been increased in 20 years since 1994. And then the other one looks at students. Post-secondary students go through a period of extreme income security followed by precarious work. And so are you able to say how students and seniors fit into this roadmap?
Thanks. So I'm going to tackle the seniors part first. I'm going to go back to the wedge that I started with on here. All right. So right now, and you can see GAINS is such a tiny sliver. GAINS is only 127 million. GAINS is actually strictly provincial. GIS and OAS are our federal amounts. GAINS was introduced due to inadequate federal funding. So you're right, they still live in poverty despite being better off than social assistance applicants. They're still far away from being fully income secure. We're asked not to comment, and I mentioned this earlier, not to comment on federal benefits, but we do. We just could not hold back. So if you go to page 145, under that section of comments we make to the federal government is to rebase OAS and GIS, the Old Age Security and Guaranteed Income Supplement, because it is a federal responsibility to deal with retirement. That is because we're a federation-based country, it is up to them to get that right. Now, they have talked about indexation and creating a seniors index, realizing that the index CPI that we currently use is based for more upper middle class individuals, and fixed incomes, especially at the lower end of this spectrum, experience more inflation. So we want to push them to not only do that, but also rebase the amounts because they are inadequate. So bottom line is we were told not to comment on seniors because it was a federal responsibility overall. And for students, so we had a lot of discussions how to treat teens and young adults on the system. And there has been changes to the system already in terms of people being able to qualify for Ontario Works even if they're still living at home. And we looked at those changes, who's an adult child and who is not, because we do want students to be able to be in school, getting what they need and moving on. Students are, after post-graduation, are part of what we're talking in this document. They're considered working age adults at that point, and we realize, especially in Ontario Works, young men under the age of 30 are finding it particularly hard to move on post-secondary. And so we want to make sure that the supports are there for individuals, but is not just employment supports, but full supports, making sure that through the more holistic caseworker-based role, that we can help in other ways besides just a job search.
Thank you. We had a few questions as well about basic income and kind of the integration or how this fits with the 4 basic income pilots that are happening throughout Ontario. Are you able to say how the principles of basic income fit in with the roadmap?
Thanks for that. And I'm about to say, yet again, we're asked not to base our work on a basic income. So basically, to envision a system that does not use basic income. And this was done for a few reasons. One, it would get us to actually fix things in the system right now. So it wouldn't be put off until we introduced a basic income across the province. So making sure rules and regulations were changed, et cetera, et cetera. But we also, at the same time, realized that basic income is a far more acceptable form publicly and even politically, way of delivering income to people. So not to say we got sneaky or anything, but we did in year 4 of our plan begin something, asked to begin something called an assured income for persons with disabilities. And it is to be modeled and developed based on the practice of the basic income pilot. Learn what works, what doesn't work. So how does basic income work for people with disabilities? Did it work during the pilot for people with disabilities? What problems did we encounter? How can we make sure that it doesn't happen in future? So as difficult as it was, because there were a number of us that think basic income would be a wonderful way to deal with the whole system, we had to hold off until we knew what was going to happen in the pilot. Some things we know were going to happen. People would be less stressed. Very easy outcome to predict, I think. But other things like the one-on-one supports. Do people still need one-on-one supports? The roundtable as one of the test sites. has found, especially people that have been on the system a long time, that might distrust the system, people that may have developmental disabilities or mental health issues, or English is a second language for them, may require supports, even to navigate the system, even to apply for the system. And so in our report, we do not, even though we say an assured income for people with disabilities, we do not say stop ODSP from existing as a program. We think the function should change to become a more holistic caseworker environment. And actually in ours, and what's already happening with the system is taking the money out of the local offices with caseworkers, and the delivery is already moving outwards as we speak in the modernization. Sorry, I'm going to take a sip of water.
Sure. Go ahead. That we have lots more questions coming in, so that'll give me just a second to take them all in. We did have a few questions about creating more awareness and providing feedback. So the first one is, recognized we do have poverty and hunger in Ontario, and are you able to point out some resources like YouTube videos, I don't know, maybe websites, brochures, anything that would help provide a better awareness with maybe a broader audience?
Oh, wow. Where can we find this? I think one of the best places that I personally know of for the province of Ontario would be the Ontario Association of Food Banks. Puts out an amazing amount of data every year, as well as Proof, the University of Toronto's Nutritional Sciences Department puts out the Food Insecurity Household Food Insecurity Report annually as well. At a national level, I'm going to toot our own horn. Canada Without Poverty does provincial profiles as well. There are some great organizations across Canada that do so. I think, though, and I'm going to be very blunt about this, one of the best things you can do in your community is create a small bureau of people with lived experience of poverty, working poor, as well as on assistance, and have them go out and start telling stories. One of the biggest misconceptions out there is probably who is in poverty. And I think it's a great way to tackle it, and it tackles it in a way that humanizes the issue instead of throwing a whole bunch of numbers that people never remember. Yeah.
And if I can also offer, Hamilton and several other communities around Ontario and across Canada have done a lot of work on living wage and creating reports that kind of looks at what the cost of living is in different communities, and who actually falls below the minimum, below a livable income, despite maybe having 1, 2, or even 3 jobs.
Thank you.
There was another question. Beth, is planning to provide feedback by the deadline. What are the most important things that they should say?
Wow. Well, thank you for actually providing feedback. I really appreciate that. I hope all groups, no matter how small, provide feedback. Even individuals with lived experience provide feedback, and they'll accept it by email or fax. Maybe get a group together to do it and have someone fax it in for you. What are the most important things we should say? Well, I'm going to get very personal about this, but raising the rates for me is number one, because hungry people make really bad job applicants. People that cannot maintain their rent are very hard to find for callbacks, the same as if you don't have a telephone. Raising the rates is huge. We applaud, obviously, the feds for coming through with the portable housing benefit, some money for portable housing benefit. We recommend one of those as well. I think the new caseworker approach is important to push, but I think it's also an opportunity to tell us where we didn't get it right or possibly what we missed. So one of the things we didn't comment fully on were couples where one person has a disability. And one of the reasons we didn't go and didn't delve into it ourselves is because it's a very touchy area. Couples that have one person working, having the person with disability as a standalone unit and not as a couple works really well because they don't get it deducted based on their spouse's income. Great. But we have other couples in units where one person has a disability where the other person is a caregiver. And so a couple's amount needs to happen, or developing, say, an Ontario Works caregiver amount. We don't know how that goes down, but there's certain areas we didn't do. So yes, we would love people to say, yes, spend this amount. By the way, this amount, I'm going to go up. There we go. The amount we're talking about that we can actually quantify over the first 3 years adds up to $3.2 billion. We're spending $32 billion, 10 times the amount minimally every year on poverty. So I know it sounds like a lot, 3.2 billion, but in the grand scheme of things, it's doable. So really pushing for that change and that you would support them.
And I think that speaks to the next question about the plan for reporting progress, to look at the social return on investment, because costing out poverty or the costs of inaction can help gain support for change, but it can also be difficult to follow up.
Sorry, I'm just going back to see if I can find that written out. I apologize.
I can read it again. The question was, does the plan for reporting progress look at social return on investment?
Yes, absolutely. And I think that's why in the in the section that we're talking about it, and what makes it a very different approach is actually looking at outcomes that are not just leaving the system. So looking at educational attainment for children living in households that receive assistance, looking at community engagement. Has volunteering gone up? Are people more involved in getting out? As well as the costs for ER. I don't know how many people are familiar, but here in Hamilton, there was a journalistic report called Code Red that showed an amazing use of ERs in areas where incomes were the lowest. And when they looked into why these numbers were so high, they realized that people were not able to access a doctor. Once they accessed a doctor, they couldn't fill their prescriptions because they couldn't afford it, or they didn't go to the doctor at all because getting there meant taking their children and themselves, and they couldn't afford the bus to get to the doctor. And so it would get to the point where the cold would become pneumonia and they would need an ambulance to bring them to ER to deal with something that should have been dealt with literally weeks before. And so we think those impacts as well. And there is a huge segment of our report that talks about the costs of inaction. We know that roughly $500 million a year increase will occur if we don't change anything at all. $500 million just for the ministry itself. And so it's not like you're going to save money by not doing anything.
Thank you. And Thank you to everyone who's been typing in their questions. Just looking at the time, Laura, it looks like we're going to have to wrap up here. I can absolutely forward you some of the other questions coming through the questions box that we weren't able to get through, so you have an idea of, what are the other questions out there. What are people coming in with from Ontario and across the country? Because this is absolutely something we would love to see in other provinces as well, not just limited it to Ontario. So I'd like to just wrap up by saying thank you again, Laura, and everybody. I hope you will stay connected with us, with Cities Reducing Poverty and the Tamarack community. You can subscribe to our online bi-monthly newsletter to get the latest news, tools, and resources from around the Poverty Reduction Network. Or you can visit us online at www.vibrantcanada.ca. And if you enjoyed this webinar, you may want to join us for our next webinar coming up on December 8th. It's From Needs to Assets, a New Approach to Community Building. And this webinar will feature John McKnight, who is the co-founder and co-director of Asset-Based Community Development Institute, and Paul Bourne, the co-founder and co-CEO of Tamarack. They'll explore the main principles of the asset-based community development approach. It's a 1-hour introductory session where you can learn about the importance of starting from capacities and assets as an essential focus of effective local community development, and the techniques that you can use to implement the strategy for creating healthier, more vibrant communities. So the registration link is there on the screen, and we'll send it to you with the recording in the follow-up couple of days. And then finally, in a few days, you will receive that follow-up email, including a link to the audio. You can email me at natasha@tamarackcommunity.ca to provide feedback about today's webinar, because we're always trying to improve on our experience. So thank you again for joining us, everyone. We hope you have a great day.